This is a video demonstration of cranial nerve assessment. And this is the 11 components that will be assessed in the assessment. And here are the equipment needed. Now, moving on to the first component, which is olfactory nerve test. The tools needed is in step order. And here is the administration procedure.
Assalamualaikum. Good morning, Miss.
Good morning.
May I know your name and your age?
My name is Alisa. I'm 30 years old.
Oh, nice to meet you, Miss Alisa.
Okay, my name is Nashaira and I'm your therapist for today's sessions.
So today, I would like to examine your cranial nerve, which is the nerve that supply your head, your face, and your neck. Would you be okay with that?
Yes.
Okay, good, Miss Alisa. So basically, there are 12 cranial nerves to be tested on you. The purpose of this test is to test whether your cranial nerve is in the right function or not. You understand?
Yes.
Okay, good. So the first cranial nerve to be tested on you is olfactory nerve, which is to test your sense of smell. Okay?
Yes.
So in this test, you need to close your eyes, occlude your nostril with your index finger, and then I will put something in front of your nose and you need to sniff and then tell me what the smell that you just smelled. Okay?
Okay.
So now, close your eyes, occlude your right nostril. I will put something in front of you. Okay, start to sniff. Sniff, okay? Can you smell this?
Yes.
Can you tell what kind of smell is this?
Coffee.
Okay, good. Now, close your left nostril. Can you sniff? Can you smell this?
Yes.
Can you tell what kind of smell is this?
Coffee.
Okay, good. Thank you, Miss Anissa.
Interpretation, patient was able to identify the odor of substance with both nostrils. It indicates the olfactory nerve intact. Moving on to the second component of the assessment, which is optic nerve. In optic nerve test, there are visual acuity, visual field peripheral, by confrontations and by wiggling, visual field central, and fundi. For visual acuity test, the tool needed is Snellen chart, and here are the administration procedure.
Okay, so next I'm going to test for your visual acuity. Okay, in this test, you need to read this text line by line from the top. Okay, so now I'm going to test for your right eyes. So you need to close your left eyes. Okay, start.
E F P T O Z L P E D P E C F D E D F C Z P F E L O B Z D D E F P O T E C L E B.
Until there. Okay, so next I'm going to proceed with the left eyes. So you need to close your right eyes. Okay.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E B D C T C T.
Until that, right? Okay, good.
Interpretation at 6 meter, patient able to read until the line number 8 on Snellen chart with both eyes. Patient score 6/8, which is above 6/6. This indicates normal visual acuity. Now, we want to test peripheral visual field by confrontation. Tool needed is neurological pink, and here are the administration procedure.
Peripheral visual field, I would like you to close your eyes opposite to mine with your hands, okay? And then I would like you to fix your gaze between my eyes, okay? And then if you see the pinhead turns red from the corner of your eyes, you need to say yes, okay? Yes. Yes. Yes.
The second test of peripheral visual field is by wiggling. It is a quick method, and here are the administration procedure.
I would like to test your visual fields by wiggling. It's a quick method. Okay, first I need you to cover your right eye, and then fix your eye gaze between my eyes. Okay, and then when you see my fingers wiggling out of the corner of your eyes, you need to say yes. Okay, now we will start.
Yes. 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 Yes.
Okay, now cover your left eye.
Yes. 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 Yes.
Based on both tests, patient response are patient able to recognize the pinhead and wiggling finger across visual field about 90 degrees temporally, 50 degrees superiorly and nasally, and 60 degrees inferiorly. Interpretation: patient has normal visual field. But if the test indicate patients have abnormal visual field, there are three possible major defects, which is the first one, homonymous hemianopia, second, bitemporal hemianopia, and the third one is scotomas. However, if patient has roughly circular area of blindness in either visual field, which is scotomas, is suspected in previous tests, the examination method need to be modified as below, which is visual field central. Tool needle is neurological pin, and here are the administration procedure.
For visual field in central, I would like you to cover your own eyes opposite of mine. Fix your gaze between my eyes. Now, I will move this pinhead across your vision. Say yes if you see the pinhead disappear.
Yes.
Okay.
Yes.
Okay, good. Now for the next hand.
Yes. Yes.
Okay, good.
For the interpretation, the examiner need to note where is patient start to see the pinhead disappear. Now, moving on to the last test of optic nerve. Tool needed is ophthalmoscope, and here are the administration procedure.
To look at the front surface of the eye, you can turn the ophthalmoscope on and change the number here in the dial to a green number that is high, either 10 or 15, and then that changes the ophthalmoscope into a magnifying glass to look at the front surface of the eye. To get the red light reflex, change it back to 0. Okay, Grace, I'm going to have a closer look at your eyes now with this machine here. If you could have a look for me in the distance over there, perhaps at the light switch. Okay. I'm going to come closer and there's going to be a bright light. I'll pop a hand on your shoulder so that we don't bump into each other.
Okay.
Okay, and look at the light for me, please.
Test interpretation, red reflex appear and normal ocular findings in both patient eyes. Now, we want to assess optic and ocular motor nerve. The first test is pupil reflex test. Those need is pen touch, and here are the administration procedure.
Now I'm going to examine your pupil responses. So if you could fix on an object in the distance for me, please.
Okay.
I'm going to shine a bright light in your eyes. It's going to go from one eye to the other eye.
Okay.
Now I'm going to go from one eye to the other eye.
Interpretation: both patient eyes respond to light, indicate normal pupil reflex. Second test is accommodation reflex test, and here is the administration procedure.
Okay, Miss Alisa. Now I want to test your accommodation reflex. Okay?
Okay.
Okay, good. So in this test, you need to focus on the object behind me, and then I will start moving my fingers in front of your eyes. You need to see my finger after that. Okay?
Okay.
Okay, now focus on the object behind me. Okay, good.
The overall interpretation for optic and oculomotor nerve, both patients' eyes respond to light and also accommodation. This indicates normal optic and oculomotor nerve. Now, let's see the fourth component of cranial nerve assessment, which is oculomotor, trochlear, and abducens nerve test. The first test is eyes movement, and here are the administration procedure.
Okay, now Miss Alisa, I will test your trochlear, abducens, and oculomotor nerve. Okay?
Okay.
So in this test, you need to follow my fingers with your eyes, and then tell me if you see double. Okay?
Okay.
Okay, now follow my fingers with your eyes and tell me if you see double. Okay?
Okay.
Did you see double?
No.
Okay, good.
Interpretation: both patients' eyes able to move as necessary and move in coordination. Next, we also want to test for nystagmus. Let's see the administration procedure.
Okay, now Miss Alisa, I want to test for your eyes condition for nystagmus. Okay?
Okay.
Okay, so in this test, you need to look at my fingers, follow my fingers movement, but do not move your head. Only move your eyes. Okay?
Okay.
Understand?
Yes.
Okay. Okay, good, Mak Lisa.
Interpretation: from the video, we can see that nystagmus is absent. This is because both patients' eyes move as necessary. The fifth component of the assessment is trigeminal nerve test. The first test is we want to test the sensory function of trigeminal nerve. Those need is cotton wool. Here are the administration procedure.
And we're going to test bilaterally in those areas you just seen. And whenever the patient feels it, tell them to say yes. And what you're looking for is equal feeling. What would be abnormal is if they don't feel it the same on each side or they have a decreased response to it. So tell me yes when you feel the sensation.
Yes. 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 Yes.
And because he has a beard, we're going to go in this area right here. We're not going to go over the hair.
Yes. Yes.
Okay, next. Now what we're going to do is test the corneal reflex, and to do this you'll want to have the patient remove their contacts if they wear them because it can throw off the test. You're going to take another cotton ball and you're sort of just going to twist it at the end like this. And what we're going to do is have the patient stare off, and you're going to take this part of the cotton ball in at the side of the eye and touch the cornea. And what you're looking for is for that eye to blink and simultaneously that other eye to blink as well. And if that didn't happen, that would be an abnormal response. Okay, so we're going to go in at the side and touch the cornea. He should blink.
From the sensory test of trigeminal nerve, we can see that patient able to feel the cotton wool on all three divisions, and both eyes blink when the cornea is touched. This indicates normal sensory function of trigeminal nerve. Next, we need to assess the motor functions of trigeminal nerve. Here are the administration procedure.
For the motor test, can you open your mouth in midline? Okay, good. Can you cleanse your teeth? Okay, good.
Interpretation, contraction of masseter and temporalis muscle were able to feel by examiners. Moving on to 6th component of cranial nerve assessment, which is facial nerve test. This is the administration procedure.
Okay, next, we move to the facial test. So, I want you to rest your eyebrow. Okay, good. So next, I want you puff out your cheeks. Okay, good. Next, I want you close your eye tightly. Okay, good. So I want you, can you whistle? Okay, good. So lastly, I want you show your teeth. Okay, good.
Interpretation, patient able to perform all facial expression without any difficulty. 7th component is auditory nerve. There are 3 tests. The first one is acoustic test. Here are the administration procedure.
For the auditory test, I will rub my finger beside your ear. If you can hear sound, say yes. 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 Okay, good.
Interpretation for acoustic test, patient able to hear the rubbing fingers in both ears. Second test for auditory nerve is Raynaud's test, and tooth snip is tuning fork, and here are the administration procedure.
For the next part of the test, you will require a 512 or 256 Hz tuning fork. To see which Hertz tuning fork you have, look at the base and the number will be located here. This is a 512 Hz tuning fork. To activate the tuning fork, you should ping it, like such, or you can tap it on your knee. The mastoid process can be located here. Where did you hear the sound best?
Second.
Where did you hear the sound better?
First.
Interpretation, patient hear air conduction is better than bone conduction. This indicates normal listener. The third test of auditory nerve is Weber test. Tooth snip, also tuning fork, and here are the administration procedure.
I'm going to ping the tuning fork, place it on the centre of your forehead. Let me know where you hear the sound best.
In the middle.
Interpretation, patient heard equally loudly in both ears, indicate normal findings. Now, moving on to the 8th component of cranial nerve test, which is glossopharyngeal nerve. In this test, tooth snip is cotton wool swab, and here are the administration procedure.
Glossopharyngeal test, I'm going to stroke your back of the tongue with this cotton wool. Okay, can you open your mouth? Bigger. Okay, one more. bigger.
Interpretation, patient get when the pharynx is stroked. Please note that gait reflex test is testing sensory function of glossopharyngeal nerve and motor function of vagus nerve. The ninth component of cranial nerve test is vagus nerve. In this test, it requires patient to open mouth and drink some water. Here are the administration procedure.
For the vagus test, I want you to say ah. Okay, good. So next, I want you to drink this water. Okay, good. If you have any problem? No. Okay, good.
Interpretation, the examiner can see that pilar movement is symmetric and the uvula remains central when patient rises. Patient also able to swallow normally. Next is the 10th component, which is accessory nerve. Here are the administration procedure.
Your accessory nerve. But for this test, you need to shrug your shoulder. Okay, shrug your shoulder. Okay, and then move your chin to the left shoulder, like this. Okay, and then to the right. Okay, good.
Interpretation, we can see that patient able to shrug his shoulders and turn his head from one side to other side. Now, moving on to the last component in cranial nerve assessment, which is hypoglossal nerve test. And here are the administration procedure.
For the hypoglossal test, I want you put out your tongue. Okay, good.
Interpretation, patient able to put out tongue without any deviated. Now, let's see the conclusion for interpretations of cranial nerve assessment.
Okay, Miss Alisa, so now we have done with all the components of cranial nerve assessment, and the result shows that there were no abnormalities detected on your cranial nerve. This means that your cranial nerve, all your 12 cranial nerve in the right function. But I want to say that if you detect any abnormalities of your sense or your movement after this, please inform, okay? Okay, so that's all for today, Miss Alisa. Thank you.